Hey guys, welcome back to Medicine Deconstructed. I'm your host, Dr. J. Rutland. You know, there's this unwritten rule in medicine where physicians are only allowed to make a dollar by seeing a patient, charging an insurance company, or charging them a cash price. For some reason, anytime a physician makes a dollar doing something else, everybody kind of raises their eyebrows a little bit, might even roll their eyes. Today we're going to discuss why I think it's perfectly okay to physicians to consult however they see fit. You're going to learn that and a little bit more here on Medicine Deconstructed. I told you all with my YouTube channel, I was gonna both focus my attention on the business aspect of medicine as well as some of my own clinical practice and clinical experience. The business side of medicine is something that's important. What I've noticed over my years of practice, which has been about, 6 years out since fellowship ended, is I've noticed that there are certain people, civilians, even other physicians, that raise your eyebrows when trained professionals, MDs, DOs, PAs, take their brain and their talent that they've developed and worked hard for over the course of the years and applied it to some consulting venture, whether it's consulting for pharmaceutical companies, whether it's consulting for medical device companies, whether it's consulting for medical education companies. Sometimes it's seen as bad or unethical or whatever you want to call it. I'm here to show you that that's not always true. I'm going to talk about 5 things that you need to know to understand that physicians are as trained as anybody else. They're as trained as lawyers, as CPAs, as producers, as content creators, and they're allowed to use their mind to make money to provide and support their family. I say this with one caveat. As long as whatever they are supporting and whatever they're consulting for does not directly harm patients, I'm cool with it. And I want you guys to know that I'm cool with it. This is the first thing. Medical school costs about $300 grand if you're an out-of-state student, at least for me. My medical school was $62,000 a year at the age of 25 or 24 when I was accepted. I got a loan for $62,000 a year. So $62,000 times 4 is what? $248,000 plus interest, about 4 to 6%, right, over the course of time. So I got to pay back about $300,000 and some change. When you're a first-year resident, you only make about 40 grand, 45 grand, so you're not paying it back. So that interest is being compounded, so you're collecting more interest. Second year resident, you're making like 44 grand. Third year resident, you're making like 47 grand, right? And then if you do a residency, that's a long period of time, right? 7 years if you're a neurosurgeon, or 10 years in some cases. Again, you're going up about 3 to 5 grand every single year. So you're not paying your loan back. It's a lot of time for that interest to accrue, and it's a lot of debt for you to accrue over time. Now you can say some doctors come from rich families and their families pay for medical school. Not mine. But that does happen, and I understand that side and that argument. But in most cases, totally not true. Number 2, business is not taught at any point along the way. What do I mean by that? It means this. I don't know how much money I make being a thoracic surgeon, being a pulmonologist, being a dermatologist. I don't know what codes mean. I don't know if I code for this procedure or that procedure or this visit or that visit. I don't know how much money it generates. So I'm going through this whole thing without learning a letter on business. 3, once you do get an understanding of business, that's when you begin to understand what it actually costs to be a doctor. What do I mean by that? You have to rent out a space, and that's just a room. So you have to rent out a space. You have to fill that space with furniture, computers. You have to fill that space with staff. So you have to pay for all of this along the way. But where's the money coming from? Because you are already in debt over $300,000, and you just finished your fellowship and your residency, and now you're expected to pay another $300,000 or $400,000 to be able to have an office, provide for your family, not to mention the fact that you got to make enough money or have enough money to pay for your staff that rely on you. It's very, very difficult. So what do? Well, you take out another loan. So now you've got more debt. You also have malpractice insurance. Malpractice insurance for me right now is about 24 grand, 25 grand a year. For neurosurgeons, it's much more, like 100 grand, right? And for other types of surgeons, it's much, much more. And so you have to think about all these things that you got to pay for. But let's go into the business a little bit more, because this is important. I really want you guys to understand this. This is point number 4. When you look at medicine, and when you think about medicine, you're like, okay, well, how do physicians make money? I'm going to tell you right now. So everything is based on Medicare. You guys have all heard about Medicare. Medicare is essentially an insurance company that pays you a certain amount of money to do certain things. And the way that they do this is by having a stable number, like a constant, called the conversion factor. The conversion factor is a dollar amount. So in 2021, the conversion factor is $32.41. In 2020, the conversion factor was $36.09. Wait, what? You mean the conversion factor went down by $4? Yeah, so what does that mean? Here's what it means. You take this conversion factor and you multiply this conversion factor by what's called a relative value unit, or an RVU, and that gives you essentially how much money you're going to make per procedure. Let me give you an example. A procedure that I've shown you guys is called a thoracentesis, right? That's where I numb somebody in the back, put a needle in their back, and drain fluid from their back. Now, to do that procedure, I have to actually perform the procedure, which is a code number called 32555. And then I do an ultrasound, which is a code number called 76604. So let's think about this conversion factor. So in 2020, right, if you took the conversion factor of 3609 and you multiplied it by the RVUs that a thoracentesis, a 32555, plus a 76604 actually is, the number you're going to come up with is about $103, okay? So you're getting paid on average about $103 per thoracentesis. Not terrible. Okay, for a procedure a professional can do in about 10, 15 minutes, not terrible. But then when you go to 2021 and the conversion factor has gone down by $4, you've gone from $103 to $92. But what about your business expense? Well, that hasn't changed. That didn't go down. Probably went up because your lease probably went up, because that's inflation. So you have a situation where you've got inflation. Things are costing more, but physicians, at least proceduralists in this case, are getting paid less. That's an issue. I'm not complaining about that. I'm simply saying we have no control essentially over how much Medicare is going to pay us for a certain procedure. Now you might say, oh, but what about visits? Because when you look at the RVUs of certain healthcare visits, those RVUs actually went up in certain scenarios. So on outpatient visits, typical average outpatient visits, the RVU went up by like 0.6 or 0.7 on average, which increases that unit to keep everything almost constant. But if you're a procedural person and you don't see a lot of clinic patients, it doesn't matter. The amount of money you're making has gone down, okay? If you're like me and you're in between, it might be a wash to a little bit less depending on what month it is, but it's something that's important for the public to understand, because this is why physicians should have the right and opportunity to be able to use their brain and the skills that they develop over time to support their families and make money. I don't want to be beholden to my pager at every given moment of my life. I don't. I love you guys and I love taking care of patients, but I don't want to have to answer every call every single minute of my short life. I don't want that. I do it and I'll continue to do it, but we have to understand that physicians are allowed to explore other avenues of income, just like any other profession. And so that's point number 5, is that physicians should be allowed to consult how they see fit. If a company comes to me and says, hey, you're really good at teaching immunology, do you think you can develop a program for my company to help us teach other physicians or students immunology? I should be able to say, yeah, no problem. There should be no bias towards, oh, I don't know if that's right for a physician to do that. It's just not right for professionals like us to continue to do things for nothing. Not when you have a significant amount of debt that you have to pay off. And sure, you guys can all say, well, don't buy the big house. Don't buy the nice car. I understand all that. But what you have to understand is that we have already delayed our life by sometimes 10 to 15 years before we actually start making money. So don't try to tell us that we can't have a certain life. I'm just asking people to understand that we're allowed to be as professional as the next person. We have learned certain things, and certain people are great at speaking. Certain people are great at educating. Certain people are great at writing. And they can take those skills and apply them to other fields to be able to generate an income. There's nothing wrong with that. And so that's the issue that I have with medicine sometimes, is other physicians and other people look at people who do other things and make money doing other things as if they're not supposed to do that. I'm just simply saying, I want to be able to be compensated for taking my time to do something, because when I do it, I'm going to do it well. I've got debts to pay. I've got kids to support. I've got weddings to pay for. I've got retirement to save up for. There are so many different aspects of my life that need to be fulfilled. What are the 5 things again? Number 1, medical school costs money, period. Significant amount of money. I'm not even talking about if you got loans for college. I'm talking about just medical school. Number 2, business isn't taught at any point along this journey. It's not. Number 3, once you get an understanding of business, you begin to think about what you have to pay for every month. Medical malpractice, employees, a space, office supplies. 4, conversion factor and RVUs. Conversion factor has gone down by almost $4 this year. So there's going to be a lot of proceduralists and a lot of surgeons who are making a lot less money. We didn't get more time. They didn't add an extra hour or 2 during the day. So they're going to have to do something else. And that's okay. No problem there. And the 5th point, you physicians, you guys are allowed to consult however you see fit. Don't hurt anybody, because we first do no harm. Don't hurt any patients. But you know what? You're smart as hell. You're able to use your brain in other areas. Go ahead and use it. Go ahead and generate income and diversify your own portfolio. That truly is medicine deconstructed. And I really appreciate you guys being here today. I'll see you guys again next week. I'm here just arming you with information. And next week, I'm going to have some more ammunition for you. Thanks for joining me.